Today's first presentation has to do with the Healthy Babies, Healthy Children program. This is a program that is all about making sure that children and young families get off to the best start possible, because we know that if you can get children on the right trajectory right from start, that is going to set them up hopefully well for the rest of their lifetime. And what's really exciting, I think, about this program is that a public health nurse is able to touch almost every single newborn child within our service area. So I'd like to invite up Arlene Rosinski, who's the manager of the program, and Ashley Lawrence, who's one of our public health nurses who works in the program, to present.
Good afternoon. My name is Ashley Lawrence, and I'm a public health nurse working within the health team. And we're here to talk to you today about our HBHC program for Healthy Babies, Healthy Children. As you can see from our organizational structure, the Healthy Babies, Healthy Children program falls under the Healthy Families team and is in the Health Promotion and Vaccine Preventable Diseases Division, led by Stacey Gilbo. We have 9.5 public health nurses. We have 7 family home visitors. Normally we would have 9. We have 1.5 office assistants, and we also receive support from our health promoter and our public health nutritionist from the Healthy Families team. Strong, healthy families form the foundation for a strong and resilient society. We know that early child development is a social determinant of health and is a critically important phase of life. Children's early experiences lay the foundation for their entire life course, including influencing adolescence and into adulthood. Adverse childhood events, or ACEs, can negatively impact health. In fact, chronic diseases such as cancer, depression, and cardiovascular diseases have been linked to ACEs. Unfortunately, some of the families in our service area experience a range of interconnected challenges that impact their health, stability, and overall well-being. However, we do know that it's been shown that positive parenting programs can have that facilitate caring relationships between families, parents, and their children can facilitate caring relationships. These programs provide parents with effective strategies and act as a protective factor against negative health outcomes. A bit of background about our program. The Healthy Babies, Healthy Children protocol falls within the Healthy Growth and Development Standard in the Ontario Public Health Standards. It is a mandatory program that is 100% funded by the Ministry of Children, Community and Social Services. It is a voluntary program. It provides prevention, early identification, and intervention services that support families in healthy growth and development and positive parenting. The goal is to optimize the health of prenatal families, newborns, and children, while working to facilitate access to services and early screening. A key component of this program is to reduce health inequities.
So the HBHC program has 2 components. It has a universal and a targeted component. As part of the universal component, a public health liaison nurse attends Health Sciences North every day, Monday to Friday, and meets with all consenting parents to provide information on our resources, such as the health information line, our infant feeding clinic, and the period of Purple Prime. Parents are also advised that a public health nurse will call them within 48 hours of their discharge from the hospital to offer support. All consenting parents are screened by hospital staff using the ministry's HBHC screening tool to assess their risk level. The HBHC screen identifies families who may need support after leaving the hospital by assessing risk factors such as maternal age, mental health, substance use, social support systems, economic challenges, and concerns with abuse or intimate partner violence. When families are contacted after being discharged from the hospital, a public health nurse completes a postpartum assessment to provide teaching, support, and where necessary, referrals to community partners. Through this assessment and the HBHC screen, families are then identified with risk and will be offered the HBHC program. The targeted part of our program includes an initial family assessment that is completed by a public health nurse within 2 visits and is used to confirm the need for the HBHC program. Families are then referred to our blended home visiting program, where they receive support from both the public health nurse as well as a family home visitor. Worth noting, many of our families become involved with the HVAC program during the postpartum period. However, families can also self-refer to the program, and we also receive many referrals from community partners, which is done through either our health information line or the Oceans e-referral platform. As noted on this chart, you can see that the number of live births in 2024, as well as how many families were screened for HVHC, which we had 92% of the families. It also shows the number of new families which were admitted to the HVHC program, as well as the number of families that were followed in 2024. To note, over the last 5 years, these numbers have remained consistent. Staff on the HVAC team provide in-home as well as virtual visits to offer information and support to families on a variety of key topics. These can include attachment and bonding between the caregiver and children, safe sleep and injury prevention, such as the period of purple crying and car seat safety, infant feeding and childhood nutrition, food insecurity and housing, positive parenting strategies, healthy growth and development, navigating the healthcare system, as well as info about other public health programs and community referrals. Public health nurses on the HVHC team also answer calls on our health information line, or as we more affectionately call it, HIL. Calls come from members of the public, community partners, as well as healthcare providers. On average, we receive approximately 1,000 calls a year, and these calls can range in subject matter from newborn care to childhood illnesses, people looking for community programs and supports for their families, such as positive parenting programs or where to access primary care providers. The public health nurse answering calls, voicemails, emails, or seeing walk-ins take a no wrong door approach. We listen to the concerns and questions and help guide them to information or programs as best we can. Whether that's a public health program such as immunizations, prenatal education, or health inspections, referring them to a community partner or program, we provide supportive listening and ensure everyone feels heard and valued. Many families participating in the HVHC program demonstrate incredible resilience while facing complex challenges. Public health nurses and family home visitors work with families across our service area to help them reach their prenatal and parenting goals by building supportive and trauma-informed relationships. Common challenges that our families experience include struggles with social and geographical isolation due to limited access to transportation, family and friend networks, as well as community connections. Our clients may have lower levels of income or education, and there can be language barriers. They also experience food insecurity and a lack of access to primary health care, and in some cases, a lack of healthcare coverage. They may have lived or living experience with violence, and they often share with us that they have mental health concerns and use substances. Over the past few years, we have seen an increase in families that are newcomers or refugees to Canada, and they are learning to live, work, and play in a new country with different cultural norms, laws, and services. The HVHC program operates in collaboration with many community partners to provide comprehensive care to meet the unique needs of our families. One of the primary responsibilities of the public health nurse is to facilitate case coordination, and this is done through referrals, case conferences, assisting the families to navigate the healthcare system, transition to school meetings, and advocating for families to receive the appropriate services.
There's been no real increase to the funding for the HVAC program for quite some time. Public Health Suffering District's Board of Health made 2 motions, one in 2019 and one in 2020, to request an increase to the base funding for the program. In 2023, we received a small funding increase of approximately $110,000, the first time since 2008. Having appropriate funding for the HVAC program is essential. Insufficient funding results in reduced numbers of home visits due to the large geographical area that we cover, as well as the increasing cost of mileage and travel time. It's also resulted in reduced opportunities for professional development and training, and for us to purchase equipment and supplies for our home visiting program. With our current staffing complement, the program always has a wait list for families to receive service. Our current operating budget is roughly $1.7 million. As we look ahead, we want to continue to advocate for increased funding. We would like to continue to pursue professional development and training opportunities so that we can enhance our supports and services to our families. Continue to collaborate with our existing partnerships and develop new partnerships within our service area. And we want to continue to support and consult with Indigenous communities at their request as they develop and enhance their HVAC program. And we also want to continue to work collaboratively with all child protection agencies, including Indigenous agencies. That concludes our presentation. Thank you.
Thank you, Arlene. Ashley, very insightful, and I'll look to members of the board. Do we have any questions for presenters?
How would someone that possibly has a midwife and a home birth have access to the service?
Through you, Mr. Chair. So we have a partnership with the midwives. So the midwives or anyone that delivers at home can also complete the HVAC screen through a partnership with Form, which is how we receive our screens electronically. So they are able to complete that screen back at their office. We can receive it here at Public Health, and then we are still able to have that communication with the family if they choose to receive our phone call and our support postpartum. So wherever someone delivers, so even if a family were to deliver outside of the Public Health Evergreen District, so in a different, even in Toronto, our health unit actually will receive their screen and we are still able to reach out and make contact with that family to ensure that they are aware of the supports for them once they come back to Sudbury.
Follow-up questions?
I don't know how this works, but is there a lactation consultant involved at all? Is that part of the service that you provide or?
So through you, Mr. Chair. So we do have an infant feeding clinic here at Public Health, and we are very lucky to have one certified IBCLC, which is an international board certified lactation consultant. And then all of the nurses, the public health nurses that work within the Healthy Babies program also receive extra training and support for lactation. So we support all of the families that have newly delivered through that postpartum phone call, ongoing contact through the health information line, through one-on-one appointments in our infant feeding clinic, as well as through the home visiting program.
Any follow-up?
Oh, sounds great.
Not seeing any questions from anybody online. Oh, sorry.
Thank you too much for the presentation. It was very thorough. How many other agencies in the city have access to this fund? And do you work closely with other health organizations? Because I know we understand the limited funding and the extreme advocacy that's required to increase funding sources, especially when it comes, well, to all populations, in fact. But for the babies and ensuring that families have those supportive mechanisms to ensure healthy babies have access to healthy growth. And so how does that coordination work other than your partnership directly with HSN and the midwives?
So the funding through Mr. Chair. So the funding that we receive is through the Ministry of Children,
Community,
and Social Services. And it's a publicly funded program that's run through health units. So that $1.7 million is given to the health unit, and then we connect with other community partners. So we do work closely with HSN because it's our birthing center.
Yeah.
But we also work closely with Manitoulin with their birthing center. Up in the Shapiro region, they tend to go to Timmins or they might go to Sault Ste. Marie. So we don't work as closely with them, but we provide the HVAC home visiting program through our office. We work closely with the midwives, but I mean, we have multiple community partners that we work with, including We worked closely with Wanapitei First Nations. They reached out to us. They actually came and spent time with us. We shared our resources. So anytime we get those reach outs, we provide as much support as we can, resources. If they want to come and shadow what we do, recognizing that they would change their programming to make it culturally appropriate.
Any question?
Thank you. Any other questions? Seeing none, I had some questions, you kept answering them before I could ask them, so well done, but I do have one question on the funding as well. We noted in this city, we participated in the Rural and Northern Immigration Program. So we're introducing, facilitating for new Canadians to move to Sudbury. Are there opportunities to look at federal funding as a result of, you know, our accommodating a number of new Canadians to possibly subsidize some of the programs like Healthy Baby, Healthy Children?
Yeah, Mr. Chair, that's a good thought. It's something that we probably should do a little bit more homework on to explore. Typically, the federal government doesn't fund local public health because they see this as a provincially, organized system. And when it comes to federalism, it's usually the federal government deals with the provincial government. They don't deal directly with things at the local level. So it's generally not been an area where we even have access to funds, but we can do a little bit more homework and see if maybe there's some opportunity, particularly I think as you highlight, with newcomers being additional people who need this support. If the federal government wants those programs to be successful, maybe there is some sort of funding and we might be able to access.
Yeah, and that's why I'm aware they won't give us direct money for it, but if we tie it to an existing program, perhaps that's the thought. Okay. All right. If there's any questions, I'd like to thank the presenters. Great job. You have a lot. And I believe we will stop the recording. Thank you.